Hello, I'm Dr. Aniketh Venkataram, consultant plastic and aesthetic surgeon at the Venkat Center for Aesthetic Health, Bangalore. I'm a trained plastic surgeon with a MCH in plastic surgery from Bangalore, and I've done advanced training in aesthetic surgery with fellowships in Belgium, USA, Taiwan, Dubai, and Istanbul. My area of expertise includes all aspects of cosmetic surgery, facial plastic surgery, particularly rhinoplasty, breast and body contouring, especially liposuction and gynecomastia. Fat transfer to the face. How is it done? How can it improve your face? What are the pros and cons? What are the various conditions that can be improved with this? What is the fat transfer procedure itself? This is a procedure that has become very popular over the last 5 to 10 years because it has become very simple and easy to do. Basically, what we do is we make a tiny hole in your stomach and we suck out some fat with a syringe. We make tiny holes in your face with needles and we inject the fat where we want to. This is the simplest way I can describe this. Typically, in our center, we do this under local anesthesia. So, you're fully awake during the procedure. You come get it done, go home immediately. There is very little downtime. You feel completely normal the next day itself. You can do all your work the next day itself. For you to go out and show your face and people not to know that you've done this procedure, that usually takes around 4 to 5 days. So, what are the advantages of fat transfer? Well, the advantages of fat transfer are that we can use it for two main reasons. One is to add volume. Empty areas of the face that need some volume, we inject fat to fill it out. Second is rejuvenation. Fat is very rich in stem cells and we prepare something called nanofat that is rich in stem cells. This is injected more superficially into the skin to improve the color and texture of the skin. So, this is why fat is a revolutionary procedure in that it gives you both these advantages. You can fill out and you can improve the color and texture, and there is no other procedure that does both these things. So, what are some of the indications of doing fat transfer? Well, in our practice, I would typically say there are three big indications for which we use fat transfer. The first one is dark circles. We have a lot of patients who have hollowness in this area. Everyone tells them they look tired, they look unhappy, they look sad, and this is where fat transfer helps. So, these dark circles, typically there's two components. One, there is an emptiness. Second, there is a dark color of the skin. And this is where, like I said, fat transfer can treat both these things. We put microfat to fill out the emptiness. We put nanofat to improve the skin color. And again, there is no other single procedure that can address both these things. The second main indication that we see is for very bad acne scars or any scars in general. So, typically with scars, these acne scars are quite deep and they are hollow. Along with that, their color and texture is different. Now, the mainstay of treatment for acne scars is lasers that can improve the color and texture. But there are very few procedures that can fill out these acne scars, fill out that depth. And that is where fat transfer plays a role. So, very deep, very bad acne scars, we put fat into each scar individually. At the same time, a lot of these patients, their face is a little sunken because of all that scarring. So, we fill out the face at the same time. And this way, we can improve the face as a whole and we can improve the depth of these acne scars, which is again something that very other few procedures can do. And the third big indication for fat grafting in our clinic is for anti-aging. As people get older, the face volume changes. Younger faces are fuller, older ages are emptier. Typically, as we get older, the eyes become more sunken, the temples become more hollow, you start getting lines here and here. And this is where fat transfer can help. We can restore the fat in the mid cheek that goes away, we can fill out the temples, we can improve these lines. And at the same time, we use the nanofat to improve the color and texture of the skin, as I mentioned. Apart from this, there are some other areas for which we use fat transfer. For example, someone has a weak chin, then they want to enhance their chin a little bit. They don't want to get a foreign material, they don't want to get an implant. So, in them, we can do a little bit of fat transfer to bring the chin forward a little bit. Same thing with improving the cheeks. So, how does fat compare with implants in this case? Well, there are pros and cons. The advantage of fat grafting is there is no cut, there is no stitch. The other advantage is there is no foreign material, it's your own body fat. Disadvantages are implants, particularly in the chin, for example, it can give you a much stronger chin and it feels more solid. So, I would say that for those people who are looking for a small increase, fat transfer is good. For those who are looking for something more substantial, implants might be better. Can fat transfer be combined with other procedures such as lasers to improve the results? Yes, but not at the same time. The day we do the fat transfer, we're not going to do lasers on the same day. We typically give a gap of 2 to 3 weeks before doing any kind of laser resurfacing procedures. So, how much fat survives after fat transfer? This is a very good question. This is one of the small downsides of fat transfer in that it can be a little bit unpredictable. Usually, when we put fat in the face, around 80% of the fat survives. But in some people, can be 50%, in some people, that can be 100%. If enough fat hasn't survived, we might have to go back in after 3 months and put in a little bit more fat. In our center, we do this in around 2% of patients. So in every 50 patients, 1% we go back and we add a little bit more fat. The thing is, if enough fat hasn't survived, you can always go back and add more. But if you put too much, thinking that some of it will go away and it doesn't, and you're left with too much, that is very hard to fix. You can't take that away. So undercorrection is fixable, overcorrection is not fixable. So are there any risks with this procedure? This is a very, very safe procedure. But any procedure anywhere in the body, there are complications that can happen. The worst complication is if an infection happens. If an infection happens, there will be pus over there. We might have to give you IV antibiotics. We might have to treat you for a few days. The chance of this happening is very, very, very low, but it is not zero. We have never seen an infection with a facial fat transfer procedure in our center, but we cannot say there never will be one. It's something like when you're crossing the road, you might be hit by a vehicle. It's something like that. Other than that, there can be some swelling, as I told you, that goes away in 4 to 5 days. There can be some bruising, which means like reddish marks in this area. Some people bruise a lot, some people hardly bruise. If you bruise, it will go away. It might take around 2 weeks to fully go away. So how long do the results last? Well, this again kind of little bit depends on you, because fat is a living material. We've been doing this procedure for almost 10 years now, and some of our earliest patients still have maintained their fat and still are maintaining the result. But we have other patients who, when they had COVID and they lost a lot of weight, this fat went away. So this fat behaves how fat behaves. You have a lot of ill health, you lose fat, this fat can go away. You're in good health, you maintain it, it lasts. So if it goes away, can you do it again? Yes, you can repeat the procedure to replace some of the fat that is lost. And in general, this fat lasts much longer than any non-surgical alternative such as fillers. Fillers will usually last you 1 year. Fat, I have seen on an average, lasts for around 5 to 6 years. So I hope this answered your questions about fat transfer to the face and the various treatments it can be used to improve. It has truly been a wonderful addition to our armamentarium.